welcome back to yet another role play card session from Tejas Academy, and this is Aishwarya and
Varsha here.
So first of all, thank you so much everyone for all the positive feedback for our last role play card session. So in that feedback session, we come across one suggestion where you people are asking to go for an unknown to known role play situation. That is why in this particular role play card session, we are choosing a situation that is unknown to known. So what do you mean by this unknown to known situations? Varsha,
Yes.
can you please tell me that?
So this usually indicates a revisit, wherein we'll definitely have the information of the patient and we need to confirm the identity of the person before proceeding with our conversation.
Yes, exactly. അതായത് we know the fact that Mr. X അല്ലെങ്കിൽ Miss X എന്ന് പറയുന്ന ഒരാൾ നമ്മളെ അപ്രോച്ച് ചെയ്യുന്നു. And we already got the information someone is approaching us. But we don't know them in person. നമുക്ക് അവരെ നേരിട്ട് അറിയില്ല. അതുകൊണ്ട് നമുക്ക് അവരുടെ ഐഡൻറ്റിറ്റി കോൺവെർസേഷൻ ഇനിഷ്യേറ്റ് ചെയ്യുന്നതിന് മുന്നേ കൺഫേം ചെയ്യണം. That is what we call unknown to known situation. Right, Varsha?
Yes.
Okay, so let's get into our role play. Good morning.
Good morning.
Please be seated.
Thank you.
Okay, so I'm a nurse working here in this community health clinic and you can call me Aishwarya. So how can I help you today?
Well, nurse, I've been referred here for an ECG procedure.
Alright, so could you please tell me your name for the confirmation purpose then?
Yes, I'm Varsha.
Alright, so let me have a look at this record books. Alright, Miss Varsha, your name is mentioned here and you have been referred by your GP for the ECG, right?
Yes.
Since you're going to have your ECG, how are you feeling now? Do you feel any chest pain or are you anxious about anything?
Well, nurse, I don't have any chest pain at the moment, but I'm really anxious.
Alright, so have you taken this ECG before?
No, nurse, and I really don't know what it actually involves.
Alright, so I totally understood your concern, Ms. Varsha, but you don't need to worry at all because you are in our safe hand and we have an excellent team to carry out this procedure also. And before moving into this ECG procedure, I will be explaining everything in relation to this procedure. Will that be okay for you?
Yes, nurse.
Alright, so when it comes to this ECG procedure, first of all, you need to remove your clothing from waist up and need to lie almost flat in the provided space. And later on we will be attaching electrodes to your arms, chest and your legs, which is connected to the ECG recording machine. Will that be okay so far?
Yes, I got an idea, nurse.
So do you have any other questions for me?
So the procedure sounds straightforward and I presume that you will be able to look into the graph and let me know what's wrong with me.
Alright, Varsha, I respect your question, but I would say doctor will be the right person to have a discussion about that. Right after this procedure, you will be immediately taken to your doctor and he will be analyzing your graph in detail. Later on, you can have a detailed discussion regarding your condition with your doctor. Will that be convenient to you?
Yeah, fine.
Okay, on that note, do you have any other questions for me?
Yes, nurse, I got your point and I really hope that this test will show what's wrong with me.
Definitely, Ms. Varsha, and that's a very reasonable question from your side and I really appreciate that as well. Yes, during this procedure, we will be measuring your heart rates, irregularities, palpitations, etc. if there is any. And along with that, it is very important for you to go for further tests depending upon your test results and your doctor's decision. Will that be convenient to you?
Yes, nurse.
Okay, so on that note, we will be proceeding with the ECG procedure. Before that, I need to ask you some questions regarding the procedure. Will that be okay?
Yes, nurse, proceed.
So are you wearing any kind of jewelry or carrying any mobile phones with you?
No, nurse, I'm not wearing any jewelry.
Okay, that's great. Then what about the mobile phone? Are you carrying with you?
No, nurse.
Okay, that's really great because in the procedure room, we are not allowed to carry your mobile phones or wear any jewelry. Is that clear to you, Ms. Varsha?
Yes, nurse, it is clear.
So I hope I have addressed all your concerns now. So do you have any other questions for me?
No, nurse, things are clear. I got an idea regarding the procedure.
That's really great, Ms. Varsha. Then it's time for our ECG procedure. So are you willing for that?
Yeah, sure, I'm willing.
Okay, on that note, I'll be going inside and we'll do the arrangements for your ECG procedure. So I request you to wait here for a couple of minutes and after that I'll be calling up your name and you can come inside. Will that be okay?
Yeah, sure.
Then thank you so much, Varsha, for your understanding.
Thank you, nurse.